Hi everybody, I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. I'm sure most of you remember that parts of Los Angeles were ravaged by catastrophic fires 6 months ago. As a result of the grueling and life-threatening work of the firefighters, these first responders were able to get a handle on the fires and minimize the loss of life. So I want to talk to you tonight to raise awareness of the danger that firefighters face on a daily basis, even when being in their stations and not responding to a call. I'm sure it may be shocking to know that cardiovascular disease, which is the #1 killer of men and women in the United States, has also emerged as a critical risk factor for firefighters and accounts for approximately 45% of all on-duty fatalities within this profession. The life of a firefighter is often romanticized and glamorized, considering the bravery and valor associated with it. However, the grim reality is that the continuing threat of cardiovascular disease looms large, leading not only to the tragic loss of life, but also contributing to significant morbidity and adverse public safety implications. So understanding the myriad of factors contributing to this phenomenon is crucial for the formulation of effective preventive strategies and ensuring the health and safety of these frontline responders. In 2012, actually, I spoke at the Los Angeles Firefighter Chiefs Association meeting down by Palm Springs, California, about cardiovascular disease, sudden death in firefighters, and the importance of having your cholesterol measured the right way. And that is by doing lipoprotein testing, which I have talked about in previous videos. Despite giving a 90-minute lecture, only 5 department chiefs, and I think there were maybe 40 or 50 there, were interested in inviting me to their stations to speak. The far majority felt that most firefighters don't want to be lectured to about cardiovascular disease by a heart surgeon. I don't know, to me that's an oxymoron, but whatever. Over the last decade, extensive research has shed light on the relationship between firefighting activities and cardiovascular disease. Strenuous physical demands during emergency calls can precipitate acute cardiovascular events, highlighting the physiologic stress firefighters endure. Studies have reported that firefighting, characterized by elevated heart rates and increased blood pressure, can push the cardiovascular system into overdrive. A study published in Circulation, which is the name of the journal, highlighted the physiologic arousal during firefighting activities doubles the incidence of heart attacks when compared to non-emergency situations, and that was published in 2020. These alarming statistics do not solely impact the individual health of firefighters. The implications extend far beyond. The presence of cardiovascular disease among firefighters poses serious public safety implications. When firefighters succumb to health crisis on the job, and not only jeopardizes the effectiveness of emergency responses, but also places additional burdens on other firefighters and emergency personnel. The resulting strain can deteriorate the collective operational capacity of fire services, posing risk to the population they're sworn to protect. And this was published in 2019 by Thompson et al. Despite our current knowledge, many fire departments and firefighters won't do anything to mitigate the risk. I've heard unions blame departments and departments blame the union. But at the end of the day, we're all responsible for our own health. So what is the conclusion? Well, the conclusion is the high prevalence of cardiovascular disease within the firefighting community represents an urgent public health crisis. Although strides have been made in understanding the underlying physiology associated with firefighting and its toll on cardiovascular health, the reality remains grim. The alarming rates of cardiovascular disease and its disproportionate occurrence during emergency duties underscores the necessity for structured initiatives aimed at reducing risk factors and promoting firefighter well-being. As we acknowledge the sacrifices made by these brave individuals, it's imperative that we also tackle the concomitant threat of cardiovascular disease, ensuring a healthier, more resilient firefighting force for the communities they serve. So I hope you learned something tonight. If you want to follow me or find out more information, you can go to my website at www.paladinmds, and I hope everybody has a great evening. Thank you so much for listening.